I have the great honor of introducing our first keynote speaker. Dr. Irshad Altheimer is a professor of criminal justice and the director of the Center of Public Safety Initiatives. He received his BA from Alabama State University and his MA and PhD in sociology from Washington State University. As director of the Center for Public Safety Initiatives, Dr. Altheimer has partnered with a diverse set of stakeholders supporting the implementation and evaluation of projects seeking to reduce violence and improve the administration of justice. His research has included partnerships with the Rochester Police Department, Monroe County Probation, the Monroe County District Attorney's Office, Rochester General Hospital, Anthony L. Jordan Health Center, and Rise Up Rochester. Over the course of his career, Dr. Altheimer has secured more than $10 million in external funding from federal, state, and private sources. Dr. Altheimer is actively engaged in scholarly research and has published articles in a variety of journals. His publications have appeared in the Journal of Research in Crime and Delinquency, Journal of Criminal Justice, Homicide Studies, Journal of Interpersonal Violence and Policing. His current research seeks to expand knowledge of dispute-related and retaliatory urban violence. Dr. Altheimer is currently the primary investigator of an innovative partnership with Anthony L. Jordan Health Center to create a support hub for victims of violence. Dr. Altheimer teaches a variety of courses, including Interventions in Criminal Justice, Introduction to Criminal Justice and Research Methods. He is also actively engaged with students outside of the classroom, serving as a mentor for student researchers at CPSI. And with that, I'd like to welcome Dr. Irshad Altheimer.
Thank you, Mark. I really appreciate it. Happy to be here with all of you today. And I'm really happy that we have this opportunity to discuss this issue. Today, I'm going to be speaking about community responses to violence. More generally, thinking about how we as a community can better respond to violence. I'm going to take a lot of time. I'm not going to spend a lot of time talking about specific programs. I want us to think about a set of principles that should guide our way forward. And I think thinking about those principles helps us to be successful at not only engaging the community, empowering community groups, but reducing violence and trauma in our community. First thing I want us to do is just think about this moment. Think about the moment. Think about everything that has transpired over the last 2 or 3 years in our society. We're in Rochester, 2021 and 2022 respectively have been some of the, in terms of homicide, some of the most violent years ever on record, 81 and 76 homicides respectively, more than double the amounts that we had seen just a few years earlier. Some disagreements about why that happened, but I think, when you look at the social disruption that we had around community and policing, coupled with the COVID-19 pandemic, I think we're facing structural challenges that we simply were not ready to deal with, and that disproportionately affected some of the most vulnerable people in our society. And so on top of at the same time that we're having this record amount of violence, there's this interest in community-based alternatives, right? And I think there's a recognition that while, for the foreseeable future, we will need law enforcement, we have neglected community-based organizations. We haven't invested in them. We haven't built their capacity. And I think we're at a point now where there's a kind of a societal recognition that we need to do more, not only on equity, but empowering community-based organizations to solve community problems, which is a great thing. We should all celebrate that moment. That interest has been subsequently followed up with increases in funding for community-based groups. So if you look at the federal level, you look at the state and local levels, you look at foundations, everywhere we look right now, people are trying to give money back to the community. And so they're, whether it's ARPA funds or new federal funds or, philanthropic groups saying now we have these millions for the community. This is a good thing. However, that turning on the faucet, if you will, in such a very, very rapid way creates real challenges, particularly as it deals with capacity of community-based groups to kind of grow really fast, and also the ability to carry out complex projects that solve really difficult challenges. Excuse me. At the same time that all of this is happening, there's very little influence on evaluation. So if you do like a study of a lot of the money that's going into the community from all these different sources, many of them, for instance, 10, 15, $20 million into the community without any evaluation component, no requirement for a research partner, no requirement to really assess, maybe a loosely funded, loosely worded response. Some of that is due to the fact that it's difficult for community-based organizations to really carry kind of the bureaucratic burden associated with evaluation. It is difficult. The challenge, however, is that if we're in a moment where we are spending millions of dollars to solve a problem and we don't assess it, how do we know what worked and how do we know what didn't work? How do we identify what really went well? How do we take the lessons from what we learned and apply it and leverage it so that we can see sustained improvement in the community? So we're at this very interesting point. The other thing that to really think about, and I think why evaluation, I know whenever the professor shows up, people say, yeah, of course, you want another grant, right? But I think the larger question that we should be asking is, what will be our response when the political winds shift, if you will, when the pendulum swings and people are not as interested in equity and people are not as interested in community-based responses to our challenges? What type of documentation will we have to defend those types of approaches if we don't evaluate it? So I think that really captures the moment. Think about this moment is really important because the challenge that we face is steep and it has major implications for the whole community. It has a ripple effect throughout the community. There's a lot of data. I was just looking at thinking about all the different work we've done over the years on violence and its impact on the community, being mindful of the 30-minute limit that I have, right? And then I just wanted to bring this one statistic up that I think really encapsulates how significant this is, right? 3,331.75 is the years of potential life lost due to homicide in Rochester in 2021 alone. We're going to be releasing this working paper hopefully in the next month, and we'll have it disaggregated by race and by gender. We know that over the last 20 years, African Americans have been around 81% of the shooting victims in the city. Similarly with the homicides, if you look at African Americans, it's about 2,500 years of potential life lost from homicides in 2021. So when you start thinking about why it's important that we get this right, there's a lot of different angles we can take. But one of the reasons that we got to get this right is because lives are at stake. And every person who is taken from our community is someone who could potentially be a net positive, someone who could be contributing to the community in really amazing ways. And every year that we lose of life is potential that is lost to develop the community, to improve living conditions, to stabilize families. We think about gun incidents. There are some important characteristics that I think it's always important to think about, particularly when we start trying to understand what types of interventions in a city like Rochester do we need. This is very important because Rochester is a place where there's tremendous need. There's tremendous deprivation, high levels of poverty. While there are some bright spots, we know that we have serious challenges. We have some of the poorest zip codes in the country right here in Rochester. And so my point is that sometimes when you go and you engage community organizations and they're trying to help individuals, trying to help gun violence victims, for instance, it can just be absolutely overwhelming because, you know, there's so much need in so many areas. And I think there's a yearning and a sense of responsibility for people to feel like they have to address every single need of the population to deal with gun violence. And I think it's important for us to recognize that while we should address those larger needs, it's also important that whatever intervention we have is focused. So when we think about gun violence in the city, what are some characteristics of that gun violence? The first thing is it involves a very small proportion of the overall population. That's every year, right? So even though we have certain neighborhoods that where it seems to be concentrated, it's a very small proportion in a given year, in a given summer, of individuals engaged in a disproportionate amount of serious gun violence. So even in some of our most challenged neighborhoods, most of our youth are not involved in that violence. This is important because oftentimes we see, you know, if you look at the last 20 or 30 years, there were efforts that oftentimes targeted whole neighborhoods, like stop and frisk, right? You turn a whole neighborhood into a minimum security prison and frisk every young Black man in the community under the assumption that they're all involved in criminality, and that's just not true. None of the data supports that. So if we know that it involves a small proportion of the overall population, then we can think about, are there ways that we can target our interventions towards those that are most high risk? This population is disproportionately Black and Latino. If we look at the last 20 years, 96% of shooting victims have been Black or Latino. 80% Black, around 15% Latino. Okay, so disproportionately in Rochester, we talk about gun violence victimization, a phenomenon affecting Black and Latino males disproportionately. Third, it often involves individuals that are cut off from our traditional institutions. They may have dropped out of school. They might not be involved in any particular church or religious institution. They may not be employed at the time. Why is this important? Because we oftentimes use traditional institutions to not only connect people, but to control behaviors. And so if that population is not part of a traditional institution, we have to think about supporting those agencies and organizations that can reach out to them and reconnect them. And so a lot of times, for instance, that's one of the values you think about, like Pathways to Peace or Street Outreach, or Rise of Rochester, some of our community-based groups, they have connections with people who are not connected to traditional institutions. This also means that when, a lot of times middle-class folk, when they think about how we can address a particular issue, we often think, first thing we think about is our institutions. We think police, hospital system, universities, schools, as the way to connect and address people's problems. And for the most part, those institutions have been successful at that. But for this population, they often are not in connection with those individuals. So how do we reach them if we don't have those traditional institutional opportunities? And how do we reconnect people in those institutions? The fourth point about our gun violence in the city is that it's concentrated in a small number of street segments. And this is actually a national phenomenon. You know, in some cities, around 6% of street segments. A street segment is like if you take a block on both sides, and you can exclude, for the sake of discussion for now, the intersections. So just the block of both sides. So you think about that block, we call it a street segment in criminology, and there's been a lot of research over the last 30 years. And nationally, we have violence concentrated in and around particular street segments. And so this means if we can focus on particular areas for instance, place-based investments, it may have dividends for whole neighborhoods. So I'll give you an example. The intersection of Jefferson and Bartlett has long been a crime hotspot, if you will, in the city. In fact, within the last year on that street segment, there were 3 homicides within the last year on that street segment. So that one street segment is about maybe 4%, 3.5% of the homicides in all the several thousand street segments in the whole city, right? If you look around the 1 mile radius of Jefferson and Bartlett, over 700 people have been shot in the last 20 years within a 1 mile radius of that street segment, right? So if you think about why is this important, because if we think about the population, the nature of the population, that should help influence what we think about our community-based interventions. Community-based interventions need to be targeted at those locations where there are the most challenges. And this is a kind of a very uncomfortable thing, right? Because most people don't want to go to those challenged areas. Even some people who work in social services don't want to be in those places, right? But again, we want to direct our resources to those in highest risk, highest need, and to those areas that are most challenging to get the biggest dividend. The second thing I want us to think about is, once we're done thinking about the population, start thinking about the role of evidence-based and evidence-informed practices in whatever we're doing. There's sometimes in the community a little bit of pushback, right? Because they say, you want me to look at some study in some place, Virginia, done by some person who doesn't look like me to apply it to Rochester. I understand that sometimes academics like myself can overstate what we know. That's kind of hard for me to say, but it's the truth. We can overstate what we know. We can overstate the impact of some of our interventions. That doesn't justify, however, rejecting all evidence and reinventing the wheel, right? So one of the things that we should think about as a community is what's out there that has worked. And fortunately now we have a lot of stuff out there. And you might say, well, I'm not a social scientist. That's okay. We have, for instance, clearinghouses. So you can look at, and if you don't know where this stuff, if you don't write this down, you can reach out to me directly and I can share it with you. For instance, there's blueprints for violence reduction. You just Google blueprints for violence, and there's all these programs that have been rated in layman's terms, descriptions of the program, how they work, and their impact. There's crimesolutions.gov. Crimesolutions.gov is a federal database that focuses more on law enforcement approaches, but the point is they have over 100 different projects that have been rated and evaluated where they can tell you this is what works and how it works, right? And so a lot of these there's a lot of stuff out there that has shown promise. So if we're in a community-based organizations, the question is, from that list, if you will, what's most applicable to our community? But there are some challenges when we think about evidence-based approaches. The first is that even some of our best evidence-based approaches sometimes have very small effect sizes, right? So in academia, we think about, does it work? It's kind of, for the sake of oversimplification, or at risk of oversimplification, there's kind of 2 dynamics at play. One is if it had an impact, was that impact statistically significant? and the size of the impact. So did it reduce violence by 5%, 10%, 50%, right? Some of our best and most amazing interventions sometimes reduce violence by 30 to 40% on streets or amongst particular populations. But we do have also some that only have 5 or 6 or 7% reductions. So it's important for you to think about that effect size. What that also tells us is that if you don't get the effect size that you want, maybe we should think about, while staying within the evidence-based framework, what is an innovation that you can use in your community to improve the program, right? And for instance, you may want to talk to some of the people who've developed the program and think through that. And so there's a risk here that by looking at evidence, by rejecting evidence, we just walk blindly. But we have to have enough flexibility to innovate if we don't get the effects that we want. The third thing to think about is that sometimes programs don't work the same in different areas. And that's very hard. I've been on programs there and people have developed, for instance, a particular project, and that project worked in several areas, but we can't get it to work in Rochester. And that's hard, but sometimes you're going to need to pivot and make changes as necessary. There's no use in continuing something that's not working, even if you spent the last year doing it. And also environmental factors impact implementation. And one of the things that I've been reflecting on is, you think about Daniel Prude, right? And the kind of government scandal that happened afterwards, and the protests. And I think we haven't come to terms with the impact that has had in our community. We haven't come to terms with that. And we should be asking questions about those things. What impact, for instance, did the Daniel Prude incident have on average citizen trust of city government? Right? Now, I'm not here to throw anybody under the bus. But what I'm saying is that if we don't wrestle with those questions, those are tough questions, I know. We don't wrestle with the fact that you have some of the poorest people in the country now are, highest levels of poverty, and now dealing with COVID. You don't wrestle with those things that have changed the environment. It's going to impact how your intervention can be implemented. If you have a government-based intervention and people no longer trust the government because of certain responses to particular incidents, and we don't deal with that reality, the intervention might not work. And so I think that we have to look at our specific environment, ask what's unique to our environment, ask what's going on in the environment that it might impact how successfully this thing might work, and then move forward. So here are some questions, I think, as we move forward, thinking about violence, that I would like community partners to think about. First of all, what evidence supports the implementation of your project? Maybe it's not some sophisticated study. Maybe it's just from discussions in the community, observations from key stakeholders. Okay, but can you articulate that evidence? Is there logic behind that evidence? Who's your target population? Target population is hard because target population sometimes can drift. Sometimes you can have we see this in different studies or different programs. Sometimes you want to target a particular population. The population is hard to deal with, right? They don't want to cooperate. They don't like the police. They don't like community groups. They cuss out the social workers. Like sometimes they're a real tough population. And oftentimes what happens in institutions that initially started out with that population will gradually move on to an easier population. And on one hand, you say, well, I can't blame you. Who wants to deal with those difficult people all day? It's easy for somebody in a university office, right, who doesn't have to deal with them to say, keep dealing with those people. I get it. But if you don't know what your target population is, or that drifts over time, how would that impact your outcomes? And another question is, how are you going to assess what you're doing? And one of the things I think we should do in Rochester is, have someone appoint, get some university professor or someone at CGR or somebody and say, listen, we're going to link these individuals with community-based groups, and we're going to help do the evaluation for the community-based groups. But how are you going to assess those processes? What are you doing to measure what you're doing? Have you thought about your key processes? Do you even know what they are? Can you articulate them? Are you just doing what you know what's right, or can you articulate it? What are your outcomes? One of the things that you have to watch for in these different projects is sometimes over time, the outcome shifts, right? So you start out saying, we want to deal with gang violence, but then gangbangers are hard to deal with, so then we go to truancy. There's nothing wrong with dealing with truancy. I'm not saying we shouldn't deal with truancy, but my point is truancy and gangbang, while there may be some overlap, those are different things. How will you overcome project challenges? Every project has challenges, every project. Every project, there are things that you thought will go a certain way that don't go that way. Every project, there's turnover. People quit their job. People get mad at their boss and they quit. How are you going to deal with that? And then the next question is, what do your collaborations look like? There's an interesting professor, Wanderman has this kind of scale of collaboration. A lot of our difficult problems need collaboration. You take, for instance, like dealing with domestic violence. Yeah, we have Willow, and Willow's phenomenal, but Willow depends on partners. What is the nature of the collaboration? Is it just superficial? Is it just you guys network and talk and pat each other on the back? Is there an accountability structure in place where when people don't do certain things on the promised collaboration, they can be held accountable? Do you have an established coordinator to coordinate the collaboration, or do you expect the collaboration just to happen by itself? So there's some interest. If you're interested, you can reach out to me. I can point you to some different ways to think about how we measure our collaborations, because a lot of times when people talk about collaboration, it's just a bunch of high-fiving, but it's not really a coordinated approach. So for instance, if you think about like a case management approach where you coordinate everything for high-risk people, that oftentimes doesn't happen in a lot of settings. So my last thing that I have here is just questions that are items for the community as we go. And this is particularly for community-based organizations. The first thing is, how well have we mapped our existing resources? But there are some efforts, I know, like My Wayfinder and other efforts, and I think those efforts are really good, and we should support those different efforts to just map what's out there. Because oftentimes when you talk to people, like I'm in this position where I get to have a lot of conversations with people, and we just sometimes have coffee, and you find all these things, and sometimes there are connections, and sometimes people know about the resources, but sometimes they don't. And you have these organizations like Together Now, you know, Nikisha Johnson, who's phenomenal at Together Now. She knows about all these connections, like her brain is a big map with the connections, right? So you have these people in the community who we can utilize as resources. How well are we mapping our resources? The second thing I think we should really talk about, how our collaborations and the nature of our collaborations. Are they truly collaborative? Do we really coordinate? Do we see each other as partners or competitors? You know, there's always that risk in the nonprofit kind of world where there's competition for grants that people are almost scared to collaborate. That hurts the community when we don't collaborate. So how deep are your collaborations? Are they just superficial, patting on the back? Do you share information? Do you work collaboratively to solve problems? Do you collectively leverage each other's strengths? Or are you just competing and talking? Who do you target? Are you ensuring that you're appropriately targeting those who need it? I think we really have to take a look at that. You know, there's this thing people say like Rochester resource rich and results poor. I don't even know if that's true, by the way, but I think of maybe what's really happening in Rochester is we have resources, but we don't direct the resources always to the right people. But I'm not, when you look at the challenges that we have as community, I'm not sure we're that resource rich. When we talk about community-based organizations, how will we ensure that we also incorporate traditional institutions and hold them accountable also? So it's nice, for instance, Action for a Better Community or Rise Up Rochester to get kind of funding and support, and Community Resource Collaborative, all these organizations. But RIT has thousands of employees and all kinds of resources. What's RIT's obligation? Doesn't RIT have an obligation to make things better? What is the institution with a $1.3 billion endowment? Doesn't RIT have some obligation? What's Rise Up's endowment? So while we're empowering community groups, let's make sure we don't take traditional institutions, U of R, RIT, Strong, RGH, all these institutions that have all these resources, they have human capital, they have capacity. What is their obligation to solve these community problems? And I'm speaking from inside the institution, right? But the point is, we should demand that these institutions prioritize the well-being of the community and that they utilize their resources to solve the problems and empower the community. What we don't want to do is say, oh, we gave Pathways and Rise Up some money, they can figure it out. My last point, and then I'll close my presentation, is we got to think about what the role for law enforcement is. There's a lot of controversy, for instance, if you think about street outreach groups sharing intelligence with law enforcement. I think the general consensus is it's not a good idea, undermines the credibility of street outreach organizations, and it puts street outreach workers potentially at risk. There's a lot of controversy around that. But the whole point is that street outreach workers don't have the authority that law enforcement does legally. They don't have a gun. They don't have all those resources. So at some point, for certain types of violence, there will need to be a law enforcement component. You can't shift everything. I see Victor just jumped on my screen on the panel. You can't shift everything to Victor, right? So while we think through this, we have to think about at what point in these kind of relationships, as we develop a strategy and we have programs, does the role of the community-based organization end, and when the role of law enforcement begins? Or if there is a collaboration, how do you do that while protecting the legitimacy of community-based organizations? And I think if we can do some of these action items, we'll be better prepared to respond to violence effectively. Thank you.